Hello, this is Dennis Scanlon. I'm Director of the Center for Healthcare Policy Research, and welcome to another episode of Ask the Experts. Today, I'm pleased to have with me Professor Max Crowley. Max is Assistant Professor of Human Development and Family Studies and Director of the Evidence to Impact Collaborative. So welcome, Max, and thanks for joining me.
Thanks for having me, Dennis.
Yeah, so I want to start really with that Evidence to Impact Collaborative. I know that is a relatively new entity kind of at the university, although something that you've been in principle kind of kicking around with others for a period of time. So could you tell us a little bit about Evidence to Impact and what that means?
Definitely. So the Evidence to Impact Collaborative is a new unit within the Social Science Research Institute, but it's really been about building up partnerships with the College of Health and Human Development and other colleges across the university, and providing or facilitating opportunities for researchers, interdisciplinary teams of researchers to come together and work closely in partnership with government or other entities to really address questions of kind of social good, of public need. And so the Evidence Impact Collaborative in particular has a couple different components within it, different units. One in particular that I think is maybe of particular interest is the Administrative Data Accelerator, which has been a unit that's been around for a few years here at Penn State, a kind of co-venture of the College of Health and Human Development and the Social Science Research Institute. And we've been particularly focused on bringing in new sensitive data to the university, but doing so often in partnership with the kind of government or agency provider of that data, and often around really interesting interdisciplinary research projects. So that's been a really exciting thing we've been doing as of late.
Great. So, one of the things you talk about there is social policy or social problems, issues, and we have many in society that span a lot of different areas and different disciplines, where we could probably be more efficient in our solutions. We can help fill gaps in needs of different populations. We can help communities or, municipal government entities address their issues. But it strikes me that like in many day-to-day operations and businesses, policymakers and those who govern are busy with day-to-day operations. Also, the political cycles don't often give them the time to explore, to analyze, to look into potential solutions that are data-driven. And it sounds like that's really sort of a role that you think Penn State can play here.
Definitely. In particular, Penn State being the land-grant university of Penn State and the state-affiliated university, we have a lot of opportunity to engage in these partnerships and leverage our unique kind of role and position with Penn State government in the Commonwealth to engage in these types of partnerships and give back in a way that Penn State has historically been really successful. Only in this way, it's in particular focused on doing high quality research in partnership with government. And that's been really, particularly gratifying, I think, for a number of the faculty members who've worked with us. So along those lines, that often looks like, working to bring sensitive data in, but then to also answer research questions that are of mutual interest both to the research community, but also to the direct needs of government. And so the questions that are most pressing for those agencies, for those departments at the moment.
Mm-hmm. How about some examples of what you think some of those most pressing questions might be, some of the ones that folks are working on here at Penn State?
Definitely. I think there's been a range of them that we've been either directly helped facilitate or been adjacent to that have been particularly exciting. So as you can imagine, one area that we've taken on over the last year has been a number of different efforts around understanding the opioid epidemic here in Pennsylvania, but also nationally. Some of that builds on existing work that we've been doing here and researchers have been doing here at Penn State, particularly the substance abuse prevention space. So with the Prevention Research Center, understanding the impact of one of their universal family and school-based prevention programs on preventing the misuse of opioids, and also mapping the impacts of those programs not only onto health outcomes, but also on the public budgets, where there's actually been fiscal cost aversion, for instance. Another was a particularly successful project with CHICPR, of course, and the Attorney General's office, and working with your center, Dennis, we have the opportunity to kind of bring together an interdisciplinary team, which you led, and then providing them not only with data, but trying that cross conversation. So that's another area where what really I think gave the inspiration between the evidence to impact collaborative was the opportunities that come from that, especially if data is sort of at the ready. And that's a big piece of this is, government doesn't wait for the research, right? The research has to be ready at the right time. And so a lot of our work operates under kind of the theories of that there really are two communities here, the research and policy communities, the need to bridge those communities, but also the importance of policy windows. And so that if our research is going to be used and it's going to be used appropriately and effectively, that it has to be ready at the right time. Sometimes that means being ready for those questions when they come along and being able to move quickly.
Right. No, very, very good. And I want to ask, I guess, I think there are lots of stereotypes that sort of exist in the world. From academics and academic researchers, we often hear that you're too slow, you're concerned more about publishing in obscure journals rather than solving social problems, so forth and so on. So, first question would be, how easy is it to motivate, researchers to actually maybe move beyond some of the ways in which they're evaluated from a kind of scientific, from an academic perspective, and to go out and get involved in that messy world of solving social problems. Likewise, if we think about politics and policy, sometimes people say evidence doesn't really matter. Things are so polarized these days. It's all opinion. It's all rhetoric. So are policymakers really going to want sort of good evidence to begin with? So maybe talk about those two issues.
Definitely, I think I'd start with the latter. There is kind of a skepticism that government at all levels has the interest or even the time to consider the research evidence in their day-to-day decision making. I think that while there are certainly settings where that might be true in specific instances, at the kind of larger, more general level, there is an interest certainly in knowing the scientific evidence when a decision maker in government is kind of going into that process of, okay, what are we going to do? What does the science say? But if that science and that evidence, that information isn't there kind of at the right time, as we were talking about, then it's definitely not used. So I would say that there is demand for it. Your kind of other question of researchers and, a lot of our incentive structures, not only at Penn State, but kind of within academia more broadly, and even sort of the scientific enterprise, does prioritize methodical, kind of thoughtful, sometimes plotting, research. And so that is often the norm. But there are certainly opportunities, as we've found, we've seen, where we can move quickly and we can provide sound insights. They might not have the depth of a many year research project, but they can help answer some of the questions. And I think that's part of the opportunity. One of the projects of the EIC, the Evidence Impact Collaborative, is funded by one of our William T. Grant funded projects, is our evaluation of our research to policy collaboration model. So this is a training model that we use for training researchers to work with legislative audiences in particular, to translate research to those audiences. In close partnership with government affairs and other folks, we're in the middle of a trial, actually, where we've randomized researchers, not just here at Penn State, but across the country, to take part of this, to receive some of the high quality capacity building that we have delivered. In an earlier pilot study with the Doris Duke Charitable Foundation, we actually found that we could change from a pre-post test the efficacy of researchers, as well as their knowledge and their self-perception of competencies to actually engage with legislative audiences, speak about the research, translate, and feel like they're actually having an impact. And so I do believe that it's a malleable thing. It's not something that is intractable.